is my ventilator setup along with my inline aerosol and inline suctioning. They do not do inline MDIs here, they just do inline aerosols. So you can see the 840 vent behind me. I'm just going to go over the setup. It's already hooked up and ready to go for the patients. So there's a filter back in here coming out of the vent going into this blue limb. So this is your inspiratory. This is the heater, the water for the heater. And you follow the blue limb all the way up to the patient. You have another temperature probe here. Here's your patient end, either hooked up to your endotracheal tube or your trach. And then you have your white expiratory limb. You can follow the white expiratory limb here, all the way back to the filter here at the vent. There is a little collection container below that sometimes fills up with water, and you just have to suction that water out. So for inline aerosol that they do, you can see it back in here. The medicine goes in here, and then you see this cord is hooked to this. So when you're ready to do your inline aerosol, you just push the button, and when you push the button, you want to make sure you see the mist back in here. Sometimes these get clogged and you just have to swap them out depending on how long the patient's been receiving aerosols or been on the vent. So for suctioning, we go back to the patient's end. So here's the patient end. So I put this piece in to make this Ballard work with their circuits. I didn't want to have to open one of their Ballards. So you can see there's a port where you can put the saline in, and then you see it's in the locked position right now because they're not suctioning, and then this would go to the wall to the suction. So we're going to suction our patient. Okay, so you always want to stabilize the tube. You push this in till you meet resistance or until the patient coughs. And then 10 to 15 seconds on the way out. And then you put more saline in to clean out your Ballard. And then when you're done, you put it back in the lock position. Then go ahead and turn the vent on. Okay, so it's already plugged into the wall. It is not hooked up to air or oxygen, so you will hear the vent alarm. And we'll just go ahead and silence that. Let me try to get this so you guys can see it better. There we go. So ideally you would already have this set up when you go to put it onto your patient. So you can see it says same patient or new patient. So if you've already set this up and put it into standby mode prior to hooking it up to your patient, you could select same patient. And then hit accept. And then all of your settings are already in there. And you can adjust stuff as you need to. If not, you go to vent setup. You put in your ideal body weight. So if I'm 5'7", my ideal body weight is 64 kilos. And then you would select what mode you want. And you have your frequency, your tidal volume. So this is set to be in volume control. So there's no pressure here. You have the PIPA 3, and it's set at 100% FiO2 currently. You can wean that down how you need to. You just want to make sure the patient's pulse ox stays above 90%. And then of course you always want to make sure you set your alarms. Go ahead and turn that off. So some other things to think about and to remember. Verifying your order in the chart. whether it's written in the chart or the physician verbally tells you what they want the vent set at, and always making sure you assess your patient. Breath sounds, heart rate, respiratory effort, blood pressure, pulse ox, before and after. So you want to know what your patient is like before, and then you want to put them on the vent and assess them again to make sure there's no drastic changes. Make sure your vent settings are set the way they should be. Make sure your suction is set up in line, hooked up to the wall. And make sure your heater is set at roughly 36 degrees Celsius. And then, of course, document.